stop pins and needles now. 6 simple exercises for numb hands and feet. If you've ever experienced that frustrating sensation of pins and needles or numb hands and feet, especially before you go to bed, I have some eye-opening insights to share with you. I'm about to reveal 6 practical exercises you can do to stop this uncomfortable numbness. If you have any kind of numbness in your feet, if you feel pins and needles in your feet, if you feel any kind of pain in your feet, or if you are suffering from diabetic neuropathy, you don't want to miss out on this video. Now, here's the best part. The information I'm sharing today is not your typical advice. These are powerful, lesser-known tips that you won't find in other videos or articles. Now, let's get into the video. Dr. Vivek, an expert who has treated countless patients, and swears by these 6 amazingly simple exercises. They are very simple, yet very effective. Try them for a few days, come back to this video, and write your feedback in the comments section down below. Exercise number 1. Make sure to sit comfortably on a chair or a stool, and then just like in this video, you have to move your legs. It's a sort of warm-up exercise, but it is going to be very effective. You move your feet up and then down by lifting the heels. There are 3 steps. This you have to repeat for 15 times and will significantly improve blood circulation of your legs, and will help you to reduce blood sugars as well. This is because you are working on your calf muscles, which store glycogen. So if you are using the energy that is stored away in your calves, your blood glucose level will drop as well. Exercise number 2. For this exercise, you need a ball and put it under your feet just like you see in the video. You have to move the ball forward and backwards, clockwise and anti-clockwise. Make sure you are not moving it too fast, but definitely not too slow as well. So, it should be a relaxed exercise where you are playing with the ball, let your feet rest on the ball, and make sure to put a bit of pressure on the ball while you are massaging it. Do it on the anterior side, and also on the lateral side of your feet. During the exercise, focus on your feet and how you are feeling. If there is a specific point, if you feel a spot where you have more pain, make sure to focus a bit more there. If you do this for a few days, you will find that the pain will become less, and you will notice that the ball will be able to move more freely in this area. We want to stimulate these muscles and make sure there is good blood flow, so you want to do this exercise quite regularly. Make sure to do these exercises with both your legs, because only then you will prevent pain on the other leg and there will be symmetry in the body. Exercise number 3. The next thing you have to do is to hold the ball between your toes. And if you manage to hold the ball, try to lift it. You will notice that this is like a complete workout for your legs. If it's difficult, this is good. You want to feel that you are really working out your legs. Again, it's all about blood circulation and engaging the muscles, so they become stronger, and this will really help you achieve that. Aim for doing it 5 to 10 times for both the legs. Exercise number 4. Now for the next exercise. Shift the ball towards your ankles and hold the ball between your ankles and press your feet together firmly, applying good pressure. By doing this, you feel tension in your thighs. You feel that your thighs are burning. If you feel any kind of discomfort in your knee joint, this means the angle is not right. You may have to shift the ball forwards or backwards to find the right angle. After pressing the ball, try to lift the ball and hold it as much as you can. Just 5 to 10 seconds should be enough. After that, just lift the ball and repeat this holding movement at least 5 times. You will find that this will really help. We just went over all the exercises that need to be done in the sitting posture. For the next ones, we will be laying down. Exercise number 5. Lay down on a yoga mat and bend the knees. We will start off with a warm-up, like we did in the other exercise, moving the feet up and down. Try to do it the same way, but now while laying down. For the next exercise, we need a towel or a blanket to add some height under your feet. Add it under your feet so your toes are pointing up slightly higher. Now, what you have to do is going to be very interesting. Try to pull the towel towards yourself. Start with one leg and then the other. It's going to be difficult in the beginning, but give it a try. You will find that it's a really good exercise for your feet. Keep on doing it as long as you feel. The most important thing is to do it regularly. Daily is preferred, especially in the beginning. Exercise number 6. For this exercise, you will have to lay down again, and there will be a bit of stretching involved. Now, this exercise is really good for lower back pain, and for pain in your hip joints, as well as for your whole legs. It's very simple, yet very effective. The only thing you have to do is move your toes outwards and inwards. Outwards and hold a few seconds. And then inwards again, hold for a few seconds. When you move your feet outwards, you should feel your spine and body stretch. So stretch it properly and then move inwards. You will feel that your shin bone and your thighs get a really good stretch. This exercise is very good for your knee joints. Do it 15 or 20 times. So these were all the exercises. Know that just like with anything in life, you need to put in a bit of effort to reach the desired results. But if you are willing to do these exercises regularly, you will be amazed by the results you get. Vitamin B12. Aside from this simple exercise, consuming the right vitamin B12 is also very important. For the next part of the video, let's take a quick look and see why the consumption of this vitamin can help you feel a lot better. First things first, what is vitamin B12 and why is it important to decrease numbness in limbs and the feeling of pins and needles? Vitamin B12, a water-soluble vitamin that plays a huge role in keeping our nervous system healthy. Specifically, it helps produce myelin, which is a fatty coating that surrounds your nerves like the insulation around wires. Without it, your nerves don't work properly. So, how does all of this relate to numbness and tingling in your hands and feet? Well, when B12 levels are low, that nerve damage can cause those familiar sensations of pins and needles, especially in the peripheral nerves, which are the nerves that send signals to your limbs. Peripheral nerves carry messages from your brain and spinal cord to your limbs. If they don't function properly due to B12 deficiency, they can start misfiring, which is what causes the numbness, tingling, or even burning sensations you might feel. Good news though, if you have B12 deficiency and you treat it, those symptoms can often improve. Restoring your B12 levels can help regenerate myelin and get your nerves back to normal, which means the tingling and numbness might go away. Most people get B12 from animal-based foods like meat, fish, eggs, and dairy. But if you're vegan or have certain conditions that affect B12 absorption, you might need supplements to get your levels back up. You can also get B12 through injections if your body has trouble absorbing it from food. Once your B12 levels are restored, you might notice a significant difference in those symptoms, sometimes within just a few weeks. But of course, make sure you talk to your doctor before starting any new supplements, especially if you're experiencing persistent symptoms. Now, let's proceed with some more powerful tips on how to combat feelings of numbness and pins and needles. Improve circulation with compression gear. If you're experiencing poor circulation in your hands or feet, wearing compression socks or sleeves can help improve blood flow. Compression garments can help with conditions like peripheral neuropathy, varicose veins, or general circulation issues. But be sure to consult your healthcare provider first to make sure it's right for you. Maintain good posture. Sometimes numbness and tingling can happen due to nerve compression caused by poor posture, especially if you're sitting or standing for long periods. Make sure your posture is aligned. Sit with your back straight and shoulders relaxed. If you work at a desk, make sure your computer screen is at eye level and take regular breaks to move and stretch. Stay hydrated and eat a balanced diet. Dehydration and poor nutrition can also contribute to numbness and tingling, so make sure you're drinking enough water and eating a well-balanced diet. Incorporate plenty of fruits, vegetables, whole grains, and healthy fats into your meals. Foods rich in omega-3 fatty acids like salmon and walnuts can support nerve health. Manage your blood sugar. If you have diabetes or prediabetes, keeping your blood sugar levels in check is crucial, as high blood sugar can cause nerve damage, leading to tingling and numbness, especially in the hands and feet. Work with your doctor to manage your blood sugar levels. Staying active, eating a balanced diet, and monitoring your blood sugar can help prevent nerve-related symptoms. Avoid tight footwear or accessories. Sometimes, the cause of tingling in your feet or hands is something as simple as tight shoes, socks, or jewelry putting pressure on nerves. Make sure your shoes fit properly and aren't too tight around your toes or the arch. The same goes for rings or bracelets. Anything that's too tight can compress nerves and cause tingling. So, why do people often get numbness in their limbs around bedtime? This is a great question, right? Numbness and the sensation of pins and needles in the limbs often become more noticeable around bedtime for a few key reasons. Here's why these sensations might seem to worsen or become more prominent when you're settling down to sleep. Decreased circulation. While resting, When you lie down or sleep, your body enters a more relaxed state, and blood flow may naturally slow down or change in certain areas, particularly in the extremities. This can contribute to temporary poor circulation, which can lead to feelings of numbness or tingling. It's more likely to happen if you're in a position that makes it harder for blood to flow freely to your arms, legs, or feet. Pressure on nerves while lying down. When you lie down to sleep, the way you position your body can create pressure on certain nerves, especially if you're lying in one position for too long. This can lead to temporary nerve compression or restricted blood flow, which can cause the sensation of pins and needles, also known as paresthesia. Example: if you sleep with your arm under your head or your leg bent awkwardly, you may pinch a nerve or restrict circulation, causing numbness and tingling. When you move or shift your position, the pressure is relieved and the sensation usually fades. Body posture and nerve compression. Some sleep positions are more likely to put pressure on nerves, causing compression neuropathy. This happens when a nerve is squeezed or pinched. For example, sleeping on your side. This can compress the nerves in your arms or legs. Sleeping on your stomach with your head turned. This can compress the nerves in your neck or arms. Bent limbs. Curling up too tightly can compress nerves in the knees, wrists, or elbows. Resting the nervous system. At night, when you're preparing for sleep, your body and nervous system switch from a more active state to a rest and repair mode. This can cause you to become more sensitive to nerve activity and fluctuations. If there are any underlying issues like nerve irritation, the decrease in activity during sleep might bring those sensations to the forefront, making them feel more intense. Muscle relaxation and nerve sensitivity. When you sleep, your muscles relax, and any tension or tightness in the body that may have been suppressing nerve irritation throughout the day can now be more noticeable. Tight muscles or muscle spasms can sometimes compress nerves and make you more aware of tingling sensations when you're at rest. There also may be more serious health conditions that are at play here. Certain medical conditions can cause nerve irritation or damage that might worsen at night, including peripheral neuropathy, common in diabetes, where nerve damage in the hands or feet can cause tingling, numbness, or pain. These symptoms can feel more pronounced at night because the body is more relaxed and there are fewer distractions. Carpal tunnel syndrome, a condition where the median nerve in the wrist is compressed, causing numbness or tingling in the fingers, which can be more noticeable when you're lying down or sleeping. Restless leg syndrome. This condition often causes uncomfortable sensations in the legs, leading to an irresistible urge to move them, particularly at night. RLS can be associated with tingling, aching, or crawling sensations in the legs. Sciatica. If you have sciatica, nerve compression in the lower back can cause tingling or numbness that's more noticeable when lying down or trying to sleep. Seek medical attention if symptoms persist. If these sensations happen often or are accompanied by other symptoms like muscle weakness, difficulty walking, or changes in vision, it's time to see a doctor. Persistent numbness or tingling can sometimes be a sign of an underlying condition that needs treatment. Conditions like diabetes, multiple sclerosis, and vitamin deficiencies can cause chronic nerve issues, so it's always a good idea to get checked out if the problem doesn't improve with simple lifestyle changes. So thank you for watching this video. If you found this video helpful, make sure to hit that like button and subscribe for more health tips and insights. Have any questions or personal experiences? Drop them in the comments below. Our audience love to hear from you, and we will be happy to answer any questions you might have. See you in the next video.